All right.
Motor vehicle roll rejection. I have my BSIs on. I'm determining scene safety. I'm considering the mechanism of injury at this time. I'm determining the number of patients. I see one patient. I'm going to go ahead and call for advanced life support. I have a high index of suspicion of possible spinal injury due to the motor vehicle roll rejection. I'm going to direct my partner to neutral line the head and hold C-spine while I attempt to determine unresponsiveness. Can you hear me? Hello, miss? Miss? And then I attempt painful stimuli. She does not respond at all. She's unresponsive at this time. And I have a poor general impression because she's unresponsive. I'm going to direct my partner to do a jaw thrust while I look, listen, and feel for breathing. I'm checking for adequate rise and fall of the chest. Alright, so I can get a quick respiratory rate right now, and I'm going to go ahead and check carotid pulse, skin color, skin temperature, and look for any serious external bleeding that may need to be controlled. She is a high priority patient because of my poor general impression and the mechanism involved here. I'm going to perform a rapid trauma exam on this patient right now and try and expedite it because she is a high priority. I'm going to start by quickly inspecting the head and scalp case for any decap BTLS, obvious injury. I'm going to go ahead and check the cervical spine for step-offs, inspect the neck for decap BTLS, tracheal deviation, or jugular venous distension. I will immediately direct my partner to size and place the cervical collar while I check clavicle, sternum, watch for adequate rise and fall of the chest. I'm going to palpate the abdomen, looking for point tenderness, rebound tenderness, or rigidity. I will also watch the patient's face to see if they grimace in pain. Okay. I'm going to gently push down on the wings of the hips and pull up. Would inspect the inguinal region if need be during the detailed physical exam. I'm going to go ahead and check the left extremity. Alright, going to check distal pulse because her feet are exposed here. If they weren't, I would do it during the details. Okay? I'm going to pinch to see if she responds neurologically. I'm going to check the right leg. Evaluator tells me the right ankle is swollen and discolored. I'll note that as a secondary injury to be treated en route. Distal pulse, a little pinch to see if she responds neurologically. Go ahead and check the left arm. Check distal pulse, pinch to see if she responds. Check the right arm. Any obvious deformity or injury, distal pulse. Evaluator tells me the right wrist is swollen and discolored. Secondary injury, I'll treat en route, pinch to see if she responds. I now want to go ahead and log roll my patient away from the injuries. I'll log roll her to the side, quickly inspect the posterior, sliding my hand down the spine looking for step-offs. I will now place her onto a spine board, and we're going to strap her in torso, legs, head last when my partner obtains baseline vital signs. I will try to get a sample history if it's available to me. From here, we're going to immediately place her in the ambulance for transport. I'd like to do a recovery. I can't remember if I placed her on non-rebreathing oxygen at 15 liters per minute. If I haven't, I would have done that as soon as I cleared the ABCs. I would have got her on high flow oxygen. Now that we have her on the board in the back of the ambulance, we're going to get ourselves en route to the hospital. I'm going to reconsider the mechanism of injury. I'm going to reevaluate my initial assessment. I'm going to go ahead and perform a detailed physical exam. I'm going to go ahead and check the head now again. I'm going to check the pupils, the face. I'm going to look for raccoon eyes or battle signs. I'm going to recheck for tracheal deviation, jugular venous distension. I'm now exposing. I'm checking sternum, visualizing the abdomen, watching for rise and fall of the chest, determining if there's any point tenderness, rebound tenderness. Evaluator mentioned earlier that the belly was rigid and distended. I notate this in the field as possible internal bleeding, and we need to just hurry the process up. I'm exposing. Again on the pelvis, up and down. Any blood in the inguinal region, I will examine. I'm going to go ahead and check that left leg. Okay, distal pulse, pinch. Go ahead and get on this right leg. Distal pulse, pinch. I will splint that en route. Left arm, distal pulse, pinch. Right arm, distal pulse, pinch. I will splint this shortly as well. Now that I've completed my detailed physical exam on this patient, I'm going to go ahead and do my focused exam, making sure I'm listening to lung sounds, determining if they're clear and equal bilaterally. I'm going to have her vital signs checked every 5 minutes because she is a priority patient. I'm going to treat this patient for shock by continuing oxygen therapy and covering her with a blanket. I'm going to observe her for changes in condition, keep an eye on my interventions, make sure the non-rebreather is functioning well and she doesn't need to be bagged. I'm going to manage the secondary injury on the wrist and ankle by splinting. My clinical impression of this patient is multi-system trauma. Chief complaint is unresponsiveness, possible internal bleeding with secondary musculoskeletal injuries. My treatment for this patient is through. Do you have any questions? Trema.